Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hello everyone, welcome. This is Dr. Jacobs. In this video, I'm gonna go over how to stop total knee replacement pain after having total knee replacement surgery, why you might have pain and how to stop that pain, and what is the procedure you should do it right after the surgery. So the symptoms of pain after total knee replacement, you might experience stiffness, weaknesses, swelling, scarring, and actually feeling instability, especially when or inability to actually straighten your knee. And you can see here, this is usually what's look like if you have really bad arthritic knee and inflamed knee. So what the surgeon do is actually they cut the condyles here, clear it up, and cut this area with having the meniscus, so they can put the hardware, which like femoral component in here. They put metal here and another metal plate and plastic here. So it's a lot of hardware that's going on inside. And with that hardware, your body gonna build the inflammation and scarring. And if you don't address that properly, you will not get full range of motion. And in this video, I will go over what proper way of doing that, because there's a common mistake in rehab to do approaches that actually cause more inflammation and cause more scarring instead of releasing the inflammation and scarring so you will recover fast. So what are the risk factors for having complication after total knee replacement? One of the risk factors, overweight, that will slow down your normal healing, and it's also related to vitamins and mineral deficiency because that's happened simultaneously with overweight. The other thing is infection. If you are experiencing infection, that's one of the things you want to talk to your surgeon, because you need to be addressed that as soon as possible, otherwise it's gonna be more complicated. So the thing that actually overlooked is improper rehab approach, and I will go over the treatment that doesn't work, that might be you going through it, so you know what is not working based on the normal healing, and we'll go over how to really work the treatment that's actually very effective to get to the root cause of the problem, which is inflammation and scarring. Vitamins and mineral deficiency could cause a complication after the surgery, because if you have deficiency, your body gonna be slow to heal. So it will take a long time to heal, and when it's take longer time, you're not gonna get full range of motion. The treatment has to be effective and immediate after the surgery if there is no complications, so you're gonna get the full recovery and full range of motion. So you can see the total knee replacement. It's the knee on the left here, normal knee. You can see how much swelling. It's part of the process. That's why you need to get the swelling under control as soon as possible. You will not be able to straighten your knee or do exercise properly unless you decrease the swelling, period. There's no other option. And at the same time, when you palpate, you will notice there's a lot of scarring. That's a part of healing. You need that. The problem is if you have too much of swelling and scarring, like the image here, you will not be able to straighten your knee. You can do forever exercises, but it will never break it or will never get you full range of motion. And I will explain to you why. Let's look at the normal healing cycle. So our body has to go through 3 stages in order to heal. So you can visualize what's going on internally. So it will make sense why you should use certain modalities and avoid other modalities, because it's not really working on addressing the root cause of the problem. So first stage of healing is swelling, redness, inflammation. The blood starts to rush to that area and you start to have pain. Second stage of healing is the scarring, proliferation stage. If your body does not build the scar tissue, it's open wound susceptible for infection. So actually scarring is part of healing. We need that. It's part of our survival. During that stage, there's actually cascade of events: scar tissue, fascia restrictions, muscle spasm, and trigger point. Last stage is a maturation stage. That's when your body gets rid of the inflammation, the scarring, anything in the proliferation stage, and clears up. As you can see here, this is normal knee. There's a lot of inflammation, a lot of scarring, and if you don't see it here, it's internally. There's a scarring, there's fascia restrictions, there is a muscle spasm involved with that. So this condition is considered to be inflammation, proliferation. You're going back and forth between this vicious cycle. I want you to visualize what's look like internally. So internally, muscle should look nice and smooth here, like this image on the left. When you start to have tear, and actually that's happened this with the surgery, they cut into the tissue. So you had cut in the tissue. Your body normal healing process has to build the scarring, to patch it, to glue it. If your body does not build the scar tissue to glue the tissue here, the tissue will be, the wound will be open, susceptible for infection. You need the scarring, you need the glue. That's a normal glue in the body. The problem is when you start to have too much of that scarring, it will prevent your joint from moving. Too much of that internal swelling will prevent from moving. So let's look at the current treatment that doesn't work actually, so you don't have to waste your time on it. Okay, it's very commonly used as steam, ice, and heat to work on decreasing the pain, relax the muscle. But when we look here, it's not going to do much for the inflammation or the proliferation stage. And actually, based on the studies, it provides temporary pain relief. So it's just bandage the issue, not addressing the root cause of the problem. The other thing that commonly used is massage, foam roller. Look here. Do you want to massage inflamed tissue to make it inflame more? And the other problem is it's impossible with the massage and foam roller to go deep to cause deep adhesion release, because foam roller is just works superficially. Massage using the knuckle or the elbow, it's not gonna go deep enough to do deep adhesion release. So that, and the studies actually shows that it provides either temporary pain relief or no long-term pain, and no long-term pain relief. The other thing is joint mobilization, which is usually not recommended for total knee. It's not really relevant to addressing the inflammation or the proliferation stage. We need to really work on that instead of just moving the joint. One of the common mistakes is stretching. And I personally used to do that after graduate from physical therapy school. But when I start to look at the studies shows it does not really provide long-term pain reduction. And actually, if you overstretch, you're gonna tear the tissue. So think about it. You have a torn tissue or a tissue try to heal that has not been glued very well, and you try to stretch it by force. What gonna do? You're gonna snap it. You're gonna tear it more. You don't wanna overstretch or stretch at all. I personally don't recommend the stretch for my patient. There are alternative safe options than stretches. So period, I don't recommend stretches for my patient. There's something else, other stuff we can do that's safer, that does not cause harm as stretching. Strengthening exercise, it's very important to introduce that, but if you have too much inflammation, too much scar tissue, the strengthening exercises will cause more inflammation. If I tell this person, oh, let's do quad sets, let's do exercises, squatting or sit to stand, they will never be able to do it, because there is a lot of fluid there. There is a lot of swelling. There is a lot of scar tissue. Strengthening exercises, the patient will not be able to do it. And it does not make sense, because there is a barrier that prevents the muscle from contracting. So before I do the strengthening exercise, we have to really get the inflammation and the scarring under control. So we have to be aggressive on decreasing the inflammation. This is it's not an option with after total knee replacement. If you continue having inflammation, it will not recover. So what I personally do, I give my patient the MagnaHeal 2. This is very strong magnetic device. The magnetic field is about 3 inches that can penetrate the body, and I have them wear it throughout the day and the night to be aggressive to decrease the inflammation. At the same time, I have them use pain relief cream that actually can be used on wound to speed up the healing process, decrease inflammation, and so the body will heal faster. So I have them use those simultaneously. At the same time, I start them on the anti-inflammatory diet, because there's certain food that actually cause internal inflammation. And we need to address if you have a common deficiency of vitamins, mineral, that has to be addressed. And one of the things that you can do at home is take advantage of ASTR. It's a free online medical evaluation that will help you to figure out what possible vitamins and mineral deficiency that actually slow down your healing. So these are very important steps to decrease the inflammation. Unfortunately, it's overlooked addressing the deficiency of vitamins and minerals and addressing the inflammation through the diet and the magnet. It's actually used a lot of modality that's actually study showed is not really very effective for decreasing inflammation and waiting for the body to decrease the inflammation by itself. But if you have deficiency or severe inflammation like this person, there is very high chance it's not gonna go down fast unless we intervene aggressively. And with the total knee, you need to be addressing it aggressively so you can get full range of motion. Otherwise, you're gonna lose range of motion and it will be hard to get it back. So the other thing we have to work on at the same time is a proliferation stage. While we're using the MagnaHeal, the anti-inflammatory diet, the pain relief cream to decrease inflammation, I use the A3 to break scar tissue, superficial scar tissue, and I use the A5 to really break deep scar tissue. And that's why I said foam roller and massage not effective, because it's impossible with the knuckle or the elbow when you do massage to go deep as the A5, and also impossible with the foam roller to do deep release. But we have to do that simultaneously while we're working on the inflammation, and there's certain steps we have to follow so we're not causing more inflammation. I cover those steps in the home self-treatment program for patient. So the other thing I want to quickly touch base on is the fascia system, because it's extremely overlooked and has significant effect on getting full range of motion for the total knee patient. So the fascia system is divided to two main categories of fascia. Superficial layer wrapping the entire body, and you can see it here in this image. The white tissue is actually the fascia system, the fascia layers. And next time when you go get stick, you will see the white filament here, and that's actually the fascia system. So, and you have the deep layer that actually wrapping a group of muscles and each individual muscle fiber. This has significant effect on getting full range of motion. To make things more complicated, but don't worry, the treatment is very simple. The deep layer is actually divided to 4 subcategories layers, and each of all these layers is actually divided to 2-3 sub layers on the top of each other. So the apparatic fascia is wrapping a group of muscles, and then we have the epimycin wrapping each individual muscle, then the premiycin wrapping each group of bundle of fibers here. Then each individual fiber is wrapped with a fascia layer. And when you have fascia restriction or scar tissue, those fascia layer on the top of each other stuck together, adhere together. So it will prevent the tissue from contracting and moving. And you're gonna feel like a band or numbness band around your knee, or you feel like the tissue is suffocating, something holding you tight. That's a fascia layer. and that's why I said massage and foam roller are impossible to go deep to release the fascia layer, because it's impossible to go to the endomycin, the premiycin, and apomycin with the hand or fingers. So what I personally use is the A1 to release superficial and apparatic fascia layers, and then I use the A5 to release the apomycin, premiycin, and endomycin. And I do all of that simultaneously while working on the inflammation. There are certain protocols we have to follow to really get the best result. So to sum it up, what should we do? We have to be aggressive on decreasing inflammation. We have to be aggressive to decrease the proliferation stage. While I'm doing that, the swelling will go down, the scarring will go down, so it will be easy for the patient to do the exercises. We cannot do the exercises first, and that because that's gonna cause more inflammation and scarring. So that's a common issue with a lot of therapists. They actually do it backward, and unfortunately they don't address the inflammation or the scarring. They depend on exercises and stretches to actually gain the range of motion, but that gain of range of motion is temporary, will not last, because the limitation of the range of motion due to the inflammation and the proliferation stage. So you need to be aggressive to decrease the inflammation, decrease the proliferation stage, and then introduce the exercises so you recover fast. And that's conclude our video, how to recover fast and relieve total knee replacement pain at home. We'll see you soon in the next video. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below, or go to asterinstitute.com.